Welcome back to my channel LinkedIn Pharma. Today we have discussed about reaching the age of adolescence, Chapter 7, Class 8. Before starting this video, please like and subscribe to my channel LinkedIn Pharma. Let's start. Introduction. Reaching the age of adolescence marks a significant milestone in the journey of human development. This transitional phase, situated between childhood and adulthood, is characterized by a cascade of physical, emotional, and cognitive changes. As individuals navigate this period of self-discovery and growth, they grapple with newfound independence, evolving identities, and a range of unique challenges and opportunities. Adolescence. Adolescence refers to the transitional stage between childhood and adulthood, typically occurring from around the ages of 10 to 19. It's a period marked by rapid physical, psychological, and social changes as individuals mature and develop into adults. During adolescence, individuals often seek to establish their identities, form relationships, and gain a greater understanding of themselves and the world around them. Example of adolescence. A 13-year-old girl who used to enjoy playing with toys now finds herself more interested in spending time with friends, discussing personal interests, and exploring hobbies that align with her emerging sense of self. Puberty. Puberty is a specific phase within adolescence when the body undergoes significant physical changes as it matures into its adult form. It's triggered by hormonal shifts, particularly the release of sex hormones like estrogen and testosterone, which lead to developments such as growth spurts, the development of secondary sexual characteristics, and an increased ability to reproduce. Example of puberty. A 12-year-old boy experiences a growth spurt, gaining several inches in height within a short period. He also notices the growth of facial hair and a deepening of his voice, indicating the onset of puberty and the maturation of his male reproductive system. Change at puberty. 1. Increase in height. During the transformative phase of puberty, a notable increase in height occurs as the body undergoes rapid growth. This growth spurt is primarily fueled by the release of growth hormones, triggering the elongation of bones and expansion of various body tissues. Example of increase in height. A 12-year-old boy, who was once one of the shorter students in his class, experiences a sudden surge in height. Over the course of a year, he shoots up by several inches, towering over his peers. His pants become too short, and he needs to replace them with longer ones to accommodate his newfound stature. This increase in height is a clear manifestation of the profound changes brought about by puberty. The calculation for full height, centimeters. Example: a boy is 9 years old and 120 centimeters tall. At the end of the growth period, he is likely to be 120 divided by 75 into 100 centimeters equals 160 centimeters tall. 2. Change in body shape. Puberty introduces significant shifts in body proportions and contours, marking a distinctive change in appearance from childhood to adulthood. These changes are a result of hormonal fluctuations that influence the distribution of fat, muscle, and bone growth. Example of change in body shape. A 13-year-old girl notices her body taking on a different form as puberty progresses. Her hips gradually widen, giving her a curvier silhouette, and her waist becomes more defined. These changes in body shape make her clothing fit differently, requiring adjustments to her wardrobe. This transformation highlights the impact of puberty on reshaping her physique and preparing her for the journey into adulthood. 3. Voice change. One of the distinctive transformations during puberty is the alteration in vocal characteristics, often referred to as a voice change. This change is a result of the lengthening and thickening of the vocal cords, influenced by hormones like testosterone in boys. Example of voice change. A 14-year-old boy begins to notice a significant shift in his voice as he goes through puberty. His once high-pitched voice gradually deepens, sounding more resonant and mature. He might find it amusing to compare recordings of his earlier voice with his current deeper tones. This voice change is a visible sign of his transition from childhood to adolescence, brought about by the physiological shifts of puberty. 4. Increased activity of sweat and sebaceous glands. During puberty, a significant physiological change occurs as the activity of sweat and sebaceous glands increases. These changes are primarily driven by hormonal fluctuations, particularly the rise in androgens like testosterone. Sweat glands. The sweat glands, also known as sudoriferous glands, become more active during puberty due to hormonal influences. This increased activity leads to higher levels of perspiration, which serves several purposes. Sweat helps regulate body temperature, eliminate waste products, and plays a role in communication and pheromone distribution, potentially affecting social interactions. Sebaceous glands. Sebaceous glands, responsible for producing sebum, an oily substance, also become more active during puberty due to hormonal changes. Sebum helps lubricate the skin and hair, keeping them moisturized. However, the heightened production can sometimes lead to oily skin and acne, as excess sebum can clog pores and contribute to the development of pimples and blackheads. Example of increased activity: a 14-year-old teenager experiences an increase in sweat and oil production on their skin. They might notice that their underarms feel damp even in cooler temperatures, and their face becomes shinier as the day progresses. Additionally, they might experience occasional breakouts of acne due to the heightened activity of sebaceous glands, a common occurrence during puberty. These changes are part of the body's response to hormonal shifts and are a normal aspect of the transition from childhood to adulthood. 5. Development of sex organs. Puberty brings about the growth and maturation of the primary sexual organs, marking a critical step toward reproductive readiness. Hormonal changes, particularly the activation of sex hormones like estrogen and testosterone, trigger the development of these organs. Example of development of sex organs: as a girl enters puberty around the age of 11, her ovaries start to develop and release eggs, initiating the menstrual cycle. She begins to experience the physical and emotional changes associated with menstruation, signaling the readiness of her reproductive system. Similarly, in boys, the testes begin to enlarge and produce sperm, reflecting the process of maturation and the potential for future reproduction. These developments of sex organs are fundamental aspects of puberty that underscore the body's transformation from childhood to adulthood. 6. Reaching mental, intellectual, and emotional maturity. Reaching mental, intellectual, and emotional maturity is a multifaceted process that occurs over the course of an individual's life, with different aspects developing at varying rates. This journey involves the growth of cognitive abilities, emotional intelligence, and the capacity to make informed decisions. Mental maturity. Mental maturity refers to the development of cognitive abilities, including critical thinking, problem solving, and decision-making skills. It involves the capacity to analyze complex situations, consider various perspectives, and arrive at reasoned conclusions. Mental maturity is an ongoing process that can continue to develop throughout adulthood as individuals gain more experiences and refine their thinking abilities. Intellectual maturity. Intellectual maturity encompasses the expansion of knowledge, curiosity, and the ability to learn from various sources. It involves a willingness to engage with diverse ideas and viewpoints, while also recognizing the limitations of one's knowledge. Intellectual maturity encourages a lifelong pursuit of learning and growth. Emotional maturity. Emotional maturity involves understanding and managing one's own emotions, as well as empathizing with the feelings of others. It encompasses emotional regulation, resilience, and the ability to handle stress and conflicts in a healthy manner. Emotional maturity also involves recognizing and addressing biases and prejudices that can impact interactions with others. Examples of reaching maturity. Mental maturity. A 30-year-old individual has developed the ability to critically evaluate information from various sources before forming opinions on complex issues. They can engage in thoughtful debates, considering multiple viewpoints and adjusting their opinions based on new evidence. Intellectual maturity. A retired person continues to attend lectures, read books, and engage in discussions about a wide range of topics. They maintain an open mind and actively seek out opportunities to expand their knowledge and engage in intellectual conversations. Emotional maturity. A teenager, when faced with a disagreement with a friend, takes the time to understand their own emotions before expressing themselves. They also consider the feelings of their friend and communicate in a respectful and empathetic manner, seeking a mutually beneficial resolution. Overall maturity: a 40-year-old individual demonstrates a balance of mental, intellectual, and emotional maturity. They make informed decisions by analyzing information, are open to new ideas, and approach challenges with resilience and emotional intelligence. They are also able to navigate complex social situations with sensitivity and empathy. Reaching mental, intellectual, and emotional maturity is a continuous and lifelong process that involves self-awareness, learning, and personal growth. It contributes to individuals' ability to navigate the complexities of life, interact effectively with others, and make meaningful contributions to their communities. Secondary sexual characters. Secondary sexual characteristics are physical traits that emerge during puberty, distinguishing males and females beyond their primary reproductive organs. These traits are driven by hormonal changes and play a role in attracting mates and indicating sexual maturity. Examples of secondary sexual characteristics. Breast development. In females, puberty triggers the release of estrogen, leading to the development of breasts. The mammary glands enlarge, and fatty tissue accumulates, resulting in a distinct chest contour. A 13-year-old girl might notice her breasts beginning to form, reflecting the effects of hormonal changes. Facial hair and muscle growth. In males, the increase in testosterone leads to the growth of facial hair and greater muscle development. As a 15-year-old boy enters puberty, he experiences higher levels of testosterone, which contribute to the appearance of a faint mustache or beard, along with a more defined muscular structure. Growth of pubic hair. Both males and females experience the growth of pubic hair during puberty, driven by the release of sex hormones. This hair, located in the genital area, underarms, and sometimes on the chest, is a visible sign of sexual maturation. A 14-year-old girl might notice the growth of pubic hair, a result of hormonal shifts. Changes in body odor and sweat glands. Hormonal changes in puberty influence sweat glands, leading to increased body odor. This change, governed by hormonal fluctuations, is more pronounced in males and females as they approach adulthood, and it plays a role in communication and mate attraction. Body fat distribution. Hormones, particularly estrogen and testosterone, influence how fat is distributed throughout the body. In females, estrogen contributes to fat accumulation around the hips and thighs, enhancing a curvier body shape. In males, testosterone affects fat distribution, leading to a different pattern. These distinct fat distribution patterns are driven by hormonal influences during puberty. Secondary sexual characteristics, guided by the intricate interplay of hormones, are crucial in signaling sexual maturity, enhancing physical attractiveness, and preparing individuals for their roles as potential parents. Role of hormones in initiating reproductive function. Hormones play a pivotal role in triggering and regulating the initiation of reproductive function during puberty. This intricate hormonal orchestration involves the release of sex hormones, which activate various physiological changes that prepare the body for sexual maturity and reproduction. Initiation of reproductive function in males. In males, the surge in LH and FSH levels stimulates the testes to produce testosterone. This sex hormone leads to the development of the male reproductive organs, including the testes and the prostate gland. It also triggers the production of sperm cells in the testes, preparing the male reproductive system for eventual fertility. Initiation of reproductive function in females. In females, the LH and FSH surge prompts the ovaries to produce estrogen and progesterone. These hormones lead to the development of the female reproductive organs, including the ovaries, fallopian tubes, uterus, and vagina. They also regulate the menstrual cycle and ovulation, enabling the release of eggs for potential fertilization. Puberty and hormonal changes. During puberty, the hypothalamus-pituitary gonadal axis becomes more active, leading to an increased secretion of GnRH, LH, and FSH. This hormonal surge triggers the physiological changes associated with sexual maturation, including the growth of secondary sexual characteristics like breast development, facial hair growth, and voice changes. In essence, the interplay of GnRH, LH, FSH, and sex hormones like testosterone, estrogen, and progesterone drives the intricate process of initiating reproductive function during puberty. These hormones orchestrate the changes necessary for fertility, marking a critical transition from childhood to sexual maturity. The onset of puberty is controlled by hormones. The onset of puberty, a critical phase of human development, is primarily regulated by hormonal signals. Hormones are chemical messengers produced by various glands in the body that play a central role in initiating and orchestrating the physiological changes that occur during puberty. Key hormones involved: gonadotropin-releasing hormone, GnRH, produced by the hypothalamus, a part of the brain. GnRH triggers the release of other hormones that directly influence puberty. Its secretion increases as an individual approaches puberty. Luteinizing hormone, LH, and follicle-stimulating hormone, FSH, released by the pituitary gland. LH and FSH are stimulated by GnRH. These hormones play a pivotal role in the maturation of the reproductive organs and the production of sex hormones. Sex hormones. In males, the main sex hormone is testosterone, produced by the testes. In females, the primary sex hormones are estrogen and progesterone, produced by the ovaries. These hormones lead to the development of secondary sexual characteristics and regulate the menstrual cycle in females. Hormonal cascade. Hypothalamus activation. As an individual approaches puberty, the hypothalamus becomes more sensitive to certain signals. GnRH release. The increased sensitivity of the hypothalamus leads to greater release of GnRH, which then stimulates the pituitary gland. Pituitary hormones release. In response to GnRH, the pituitary gland releases LH and FSH into the bloodstream. Sex hormones production. LH and FSH travel to the gonads, testes in males, ovaries in females, triggering the production of sex hormones, testosterone in males and estrogen and progesterone in females. Physical changes. These sex hormones lead to the development of secondary sexual characteristics, growth spurts, voice changes, and the maturation of reproductive organs. Example: as a girl approaches puberty around the age of 10, her hypothalamus starts releasing higher amounts of GnRH. This stimulates the pituitary gland to release LH and FSH. These hormones, in turn, prompt the ovaries to produce estrogen. The increasing levels of estrogen led to the development of breast tissue, the widening of hips, and the start of menstrual cycles. The entire process, from GnRH release to the onset of physical changes, is a result of the finely tuned hormonal cascade that marks the onset of puberty. In summary, hormones, particularly GnRH, LH, FSH, and sex hormones like testosterone and estrogen, play a central role in initiating the complex series of events that define the onset of puberty and its accompanying physical, emotional, and cognitive changes. Reproductive phase of life in humans. The reproductive phase of life in humans encompasses the period during which individuals are biologically capable of reproducing and contributing to the continuation of the species. This phase begins at the onset of puberty, when sexual maturity is achieved, and it continues until menopause in females or a decrease in reproductive capability in males. Key stages and features. Puberty and adolescence. The reproductive phase begins with puberty, typically around the ages of 10 to 14, when hormonal changes lead to the development of secondary sexual characteristics. These changes prepare individuals for potential reproduction, including the maturation of primary reproductive organs, testes in males and ovaries in females, and the ability to produce sperm or eggs. Fertility and reproductive potential. During the reproductive phase, individuals are biologically capable of conceiving and producing offspring. Females experience menstrual cycles, during which an egg is released from the ovaries and can be fertilized by sperm. Males produce sperm continuously, with the potential to fertilize eggs. Reproductive activity. This phase is characterized by the potential for sexual activity and reproduction. Individuals seek partners for procreation, and the desire for intimacy in parenthood often become central aspects of their lives. Parenthood and family building. Many individuals choose to become parents during this phase, either through natural conception or assisted reproductive technologies. This period involves pregnancy, childbirth, and raising children to maturity. Menopause, females, and andropause, males. The reproductive phase typically ends with menopause in females, usually around the age of 45 to 55, when the ovaries stop releasing eggs and hormonal changes lead to the cessation of menstrual cycles. In males, a similar phase called andropause involves a gradual decline in testosterone levels, leading to decreased fertility and changes in sexual function. Significance. The reproductive phase is a fundamental aspect of the human life cycle, contributing to the continuation of generations and the survival of the species. It is a time of profound biological, emotional, and social changes as individuals navigate relationships, family planning, and the responsibilities of parenthood. The reproductive phase serves as a bridge between early development and the later stages of life, shaping the trajectory of individual experiences and human society as a whole. How is the sex of the baby determined? The sex of a baby is determined by the combination of sex chromosomes inherited from both parents. In humans, there are two primary types of sex chromosomes, X and Y. Each individual has a pair of sex chromosomes, and the combination of these chromosomes determines whether the baby will be male or female. Male sex determination. Males have one X and one Y chromosome in their sex chromosome pair. The presence of the Y chromosome triggers the development of male reproductive organs and the production of male sex hormones. The Y chromosome carries the genetic information for the development of male-specific traits. Female sex determination. Females have two X chromosomes in their sex chromosome pair. The absence of a Y chromosome leads to the development of female reproductive organs and the production of female sex hormones. Both X chromosomes contribute to the genetic information that guides the development of female-specific traits. Combination during conception. When an egg containing one X chromosome is fertilized by a sperm containing either an X or Y chromosome, the resulting combination of sex chromosomes determines the baby's sex. XX combination. If the sperm carrying an X chromosome fertilizes the egg, the baby will have two X chromosomes, XX. This combination results in a female baby. XY combination. If the sperm carrying a Y chromosome fertilizes the egg, the baby will have one X and one Y chromosome, XY. This combination results in a male baby. The determination of the baby's sex happens at the moment of conception when the egg and sperm fuse to create a fertilized embryo. The sex chromosomes inherited from both parents determine the baby's biological sex and contribute to the development of primary and secondary sexual characteristics as the baby grows and matures. Hormones other than sex hormones. Hormones play crucial roles in various physiological processes beyond the regulation of sex characteristics and reproduction. These hormones help maintain homeostasis, support growth, metabolism, and respond to stress. Here are some examples of hormones and their functions. Insulin. Produced by the pancreas, insulin regulates blood sugar levels by facilitating the uptake of glucose into cells. It helps maintain stable energy levels and prevents excessive blood sugar concentrations. Thyroid hormones, T3 and T4, produced by the thyroid gland. These hormones regulate metabolism, body temperature, and energy expenditure. They influence the function of various organs and systems in the body. Cortisol. Produced by the adrenal glands, cortisol is involved in the body's stress response. It helps regulate metabolism, immune responses, and inflammation. It also plays a role in maintaining blood pressure. Adrenaline, epinephrine, and noradrenaline, norepinephrine, also produced by the adrenal glands. These hormones are involved in the fight or flight response. They increase heart rate, dilate airways, and prepare the body for immediate physical action in response to stress. Growth hormone, produced by the pituitary gland. Growth hormone promotes growth, cell reproduction, and regeneration in the body. It is especially important during childhood and adolescence for bone and tissue growth. Melatonin, produced by the pineal gland. Melatonin helps regulate the sleep-wake cycle, circadian rhythm. It increases in the evening to induce sleepiness and decreases in the morning to promote wakefulness. Parathyroid hormone, PTH, produced by the parathyroid glands. PTH regulates calcium levels in the blood. It increases calcium release from bones, enhances absorption in the intestines, and reduces calcium loss through the kidneys. Leptin, produced by fat cells. Leptin helps regulate appetite and energy balance. It sends signals to the brain to indicate satiety and influences the body's metabolism. Aldosterone, produced by the adrenal glands. Aldosterone regulates fluid and electrolyte balance by promoting sodium retention and potassium excretion in the kidneys. It helps maintain blood pressure. Oxytocin, produced by the hypothalamus and released by the pituitary gland. Oxytocin is known as the love hormone. It's involved in social bonding, childbirth, and milk ejection during breastfeeding. These examples highlight the diverse roles that hormones play in maintaining the body's overall function, growth, metabolism, and response to various internal and external stimuli. Hormones are critical messengers that help coordinate a wide range of physiological processes to ensure the body's optimal functioning. Role of hormones in completing the life history of insects and frogs. Hormones play a crucial role in orchestrating the various stages of an insect's and a frog's life history, from egg to adulthood. These hormones, secreted by specialized glands, regulate metamorphosis and the transition between different life stages. Insects. Molting and growth. Insects undergo a process called molting, shedding their exoskeleton to allow for growth. The hormone adolescence is responsible for triggering molting. During each molt, the insect's body expands and hardens to accommodate its increasing size. Metamorphosis. Insects often go through complete metamorphosis, which involves distinct stages: egg, larva, pupa, and adult. The transformation from one stage to another is controlled by hormones. The transition from larva to pupa is regulated by juvenile hormone, which inhibits the development of adult structures. Pupation and adult emergence. The pupa is a non-feeding stage during which the insect undergoes dramatic internal changes. The hormone adolescence triggers the formation of the pupal cuticle. Later, adolescence initiates the final molt to emerge as an adult insect. Frogs. Egg development. In frogs, hormone secretion begins with the female releasing eggs into the environment. Hormonal cues trigger the male to release sperm, which fertilize the eggs externally. Tadpole stage. After fertilization, the eggs develop into tadpoles. The growth and development of tadpoles are influenced by thyroid hormones. Tadpoles feed and grow, gradually developing limb buds and lungs. Metamorphosis. The transition from tadpole to adult frog involves metamorphosis. Thyroid hormones, particularly thyroxine, play a key role in this process. They stimulate the development of limbs, resorption of the tail, and transformation of gills into lungs. Emergence as adults. Once metamorphosis is complete, the thyroid hormones decrease, and the frog emerges from the water as a juvenile or adult. The reproductive organs mature under the influence of gonadotropic hormones, allowing the frog to reproduce. In both insects and frogs, hormones act as signaling molecules that regulate growth, development, and reproduction. They trigger physiological changes at specific stages, ensuring that the life cycle progresses smoothly and adapts to environmental conditions. Hormones help these organisms navigate the transition from one life stage to another, ultimately ensuring the survival and reproduction of their species. Reproductive health. Reproductive health refers to the state of physical, emotional, and social well-being in all aspects of reproduction throughout one's life. It encompasses not only the absence of disease or dysfunction but also the ability to make informed and autonomous choices about one's sexual and reproductive life. Reproductive health involves a comprehensive approach that addresses both individual and societal factors. Key aspects of reproductive health. Safe and responsible sexual behavior. Promoting safe and responsible sexual behavior involves educating individuals about contraception, preventing sexually transmitted infections, STIs, and reducing risky behaviors. Family planning. Access to family planning services allows individuals and couples to make informed decisions about when and how many children to have. It includes access to a range of contraceptive methods. Maternal health, ensuring safe pregnancies, childbirth, and postnatal care is crucial for both the mother's and baby's health. Adequate prenatal care and skilled attendance during childbirth can significantly reduce maternal and neonatal mortality. STI prevention and management. Preventing and managing sexually transmitted infections is essential for maintaining reproductive health. Early detection, treatment, and education about STIs are key components. Infertility management. Addressing infertility involves offering couples access to diagnosis, treatment, and support. Infertility management aims to enable couples to have the desired number of children. Adolescent reproductive health. Providing age-appropriate education and services to adolescents is vital. This includes information about puberty, sexual health, and access to contraception. Gender equality and empowerment. Ensuring gender equality and empowering individuals, particularly women and girls, is fundamental to reproductive health. Empowered individuals are better equipped to make informed choices about their reproductive lives. Prevention of unsafe abortions. Access to safe and legal abortion services, along with post-abortion care, helps prevent complications from unsafe procedures. Sexual and reproductive rights. Reproductive health is closely tied to human rights. Individuals have the right to make choices about their reproductive lives, free from discrimination, coercion, or violence. Sexual education. Comprehensive and accurate sexual education is essential for promoting healthy attitudes and behaviors related to sexuality, relationships, and reproductive health. Promoting reproductive health involves a holistic approach that recognizes the interplay between biological, social, economic, and cultural factors. By ensuring access to information, services, and support, individuals and communities can make informed choices that contribute to their overall well-being and the health of future generations. Nutritional needs of adolescents. Adolescence is a critical period of growth, development, and maturation, making proper nutrition essential for supporting these changes. Adequate nutrition during this stage helps ensure optimal physical growth, cognitive development, and overall well-being. Adolescents have specific nutritional needs due to their rapid growth and changing body composition. Here are some key aspects of their nutritional requirements. Calories. Adolescents experience growth spurts and increased physical activity, requiring more calories to support energy needs. However, it's important to balance calorie intake with physical activity to prevent unhealthy weight gain. Protein. Protein is crucial for growth, tissue repair, and the development of muscle mass. Lean meats, poultry, fish, eggs, dairy products, legumes, and nuts are excellent sources of protein. Calcium and vitamin D. Adequate calcium and vitamin D intake is essential for bone development and maintenance. Dairy products, fortified foods, leafy greens, and exposure to sunlight are sources of these nutrients. Iron. Iron supports proper cognitive function and energy production. Adolescent girls, in particular, need sufficient iron to account for menstrual blood loss. Lean meats, poultry, fish, fortified cereals, beans, and leafy greens are good iron sources. Fiber. A diet rich in fiber supports digestive health and helps maintain a healthy weight. Whole grains, fruits, vegetables, legumes, and nuts are excellent sources of dietary fiber. Vitamins and minerals. Adolescents need a variety of vitamins and minerals, including vitamin A, vitamin C, vitamin E, zinc, and magnesium, to support immune function, skin health, and overall growth. Healthy fats. Essential fatty acids are important for brain development and hormone production. Include sources of healthy fats such as avocados, nuts, seeds, and fatty fish like salmon. Hydration. Staying well hydrated is essential for overall health, physical performance, and cognitive function. Water is the best choice for hydration. Limit added sugars and processed foods. Adolescents should limit their consumption of sugary snacks, sugary beverages, and processed foods high in added sugars and unhealthy fats. Balanced diet. Encourage adolescents to follow a balanced diet that includes a variety of nutrient-rich foods from all food groups. Eating habits and behavior. Promote healthy eating habits, including regular meals and snacks, balanced food choices, and mindful eating. Adolescents should be encouraged to listen to their body's hunger and fullness cues. Physical activity. Physical activity complements a healthy diet and supports overall growth and development. Encourage adolescents to engage in regular physical activity they enjoy. Consultation with healthcare professionals. Nutritional needs can vary based on factors such as growth, activity level, and individual health conditions. It's recommended for adolescents and their parents to consult healthcare professionals, such as registered dietitians or pediatricians, to ensure they are meeting their specific nutritional needs. Personal hygiene. Personal hygiene refers to the practices and habits that individuals adopt to maintain their cleanliness, health, and well-being. Proper personal hygiene is essential for preventing the spread of diseases, promoting physical health, and contributing to overall self-confidence. Here are some key aspects of personal hygiene. Hand hygiene. Washing hands with soap and water is one of the most effective ways to prevent the spread of germs. Hands should be washed before meals, after using the restroom, and after coughing or sneezing. Oral hygiene. Regular brushing and flossing of teeth help prevent dental issues such as cavities and gum disease. Use fluoride toothpaste, replace toothbrushes regularly, and consider using mouthwash. Bathing and showering. Regular bathing or showering helps remove dirt, sweat, and bacteria from the skin. Pay attention to areas like the underarms, groin, and feet. Hair care. Keeping hair clean and well-groomed is important for preventing scalp issues and maintaining overall hygiene. Nail care. Regularly trim and clean nails to prevent the buildup of dirt and bacteria. Avoid biting nails, as it can introduce germs into the mouth. Clothing. Wear clean clothes and change them regularly. Wash clothes, especially undergarments, after each use. Foot care. Keep feet clean and dry to prevent fungal infections. Trim toenails straight across to prevent ingrown nails. Deodorant or antiperspirant. Using deodorant or antiperspirant helps control body odor and sweating. Menstrual hygiene. Proper menstrual hygiene practices include using clean and appropriate sanitary products, changing them regularly, and maintaining good genital hygiene. Respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing to prevent the spread of respiratory droplets. Eye and ear care. Keep your eyes and ears clean. Avoid inserting objects into the ears, as it can damage the ear canal and eardrum. Genital hygiene. Clean genital areas with mild soap and water. For females, wipe from front to back after using the restroom to prevent the spread of bacteria. Footwear. Wear clean and comfortable footwear that provides support and protects your feet. Sleep hygiene. Maintain good sleep hygiene by keeping your sleeping area clean and changing bed linens regularly. Mental and emotional well-being. Personal hygiene also includes taking care of your mental and emotional well-being. Practicing self-care, managing stress, and seeking help if needed are important aspects of overall hygiene. Importance. Practicing good personal hygiene not only promotes physical health but also contributes to self-confidence, social interactions, and overall quality of life. By adopting consistent hygiene habits, individuals can protect themselves and others from illness and maintain a positive self-image. Physical exercise. Physical exercise, also known as physical activity, refers to any bodily movement that requires energy expenditure and engages various muscle groups. Regular physical exercise is essential for maintaining overall health, improving fitness levels, and preventing various chronic diseases. It contributes to physical, mental, and emotional well-being. Here are the key aspects of physical exercise. Types of physical exercise. Aerobic exercise. Aerobic activities increase heart rate and involve continuous, rhythmic movements that use large muscle groups. Examples include walking, jogging, cycling, swimming, and dancing. Strength training, also known as resistance or weight training. Strength training involves lifting weights or using resistance bands to build muscle strength, tone, and endurance. Flexibility exercises. Stretching exercises help improve flexibility, range of motion, and prevent muscle stiffness. Yoga and Pilates are examples of exercises that focus on flexibility. Balance and stability exercises. These exercises help improve coordination and prevent falls. Activities such as Tai Chi and specific yoga poses can enhance balance. Benefits of physical exercise. Cardiovascular health. Regular exercise improves heart health by strengthening the heart muscle, lowering blood pressure, and enhancing circulation. Weight management. Physical activity helps burn calories and maintain a healthy weight by balancing energy intake and expenditure. Muscle and bone health. Strength training promotes muscle growth and helps maintain bone density, reducing the risk of osteoporosis. Mental well-being. Exercise stimulates the release of endorphins, which are natural mood enhancers. It can reduce stress, anxiety, and symptoms of depression. Improved fitness. Regular exercise improves aerobic fitness, muscular strength, and endurance, enhancing overall physical performance. Metabolism. Physical activity boosts metabolism, aiding in efficient energy utilization and supporting weight loss or maintenance. Enhanced flexibility and balance. Flexibility exercises increase range of motion, while balance exercises improve stability in coordination. Reduced risk of chronic diseases. Regular exercise lowers the risk of chronic conditions such as heart disease, type 2 diabetes, and certain types of cancer. Improved sleep. Engaging in physical activity can lead to better sleep quality and duration. Guidelines for physical exercise. Frequency. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities on 2 or more days. Intensity. Moderate intensity activities should cause a noticeable increase in heart rate, while vigorous intensity activities result in rapid breathing and a significant increase in heart rate. Progression. Gradually increase the intensity, duration, and complexity of exercises to avoid plateaus and prevent injuries. Safety. Consult a healthcare professional before starting a new exercise routine, especially if you have pre-existing health conditions. Variety. Incorporate a mix of aerobic, strength, flexibility, and balance exercises to achieve well-rounded fitness. Enjoyment. Choose activities you enjoy to increase motivation and consistency. Regular physical exercise is a cornerstone of a healthy lifestyle. Whether it's a structured workout routine or everyday activities like walking, staying active contributes to improved overall health and well-being. Saying no to drugs. Saying no to drugs is a powerful choice that promotes physical and mental well-being, responsible decision-making, and a brighter future. By choosing to avoid the use of drugs, you are prioritizing your health, safety, and the potential for a fulfilling life. Remember that your choices have the power to shape your journey, and by saying no to drugs, you are embracing a path of strength, resilience, and positive growth. Stand firm in your commitment to a drug-free life and the limitless possibilities it brings. Adolescent pregnancy. Adolescent pregnancy refers to pregnancy occurring in individuals between the ages of 10 and 19. It is a complex and significant public health concern with implications for the well-being of both the pregnant individual and their child. Adolescent pregnancy can have far-reaching physical, emotional, social, and economic effects, which makes understanding its causes, consequences, and preventive measures crucial. Causes. Lack of sexual education. Inadequate access to comprehensive sexual education and information about contraception can contribute to unintended pregnancies. Limited access to contraception. Challenges in accessing and using contraception effectively can increase the risk of unintended pregnancies. Early sexual activity. Engaging in sexual activity at a young age without proper education and preventive measures can lead to unintended pregnancies. Social and cultural factors. Societal norms, cultural beliefs, and peer pressure can influence sexual behaviors and contribute to early pregnancies. Lack of empowerment. Adolescents who lack decision-making power or control over their bodies may be at a higher risk of unintended pregnancies. Consequences. Health risks. Adolescent mothers face higher risks of complications during pregnancy and childbirth due to their bodies still developing. Educational disruption. Adolescent pregnancy can lead to school dropout, limiting educational and career opportunities. Economic challenges. Young parents may struggle financially due to limited job prospects and resources. Psychological impact. Adolescent parents may experience increased stress, anxiety, and social isolation. Child development. Children born to adolescent parents may face developmental challenges due to inadequate prenatal care and parenting skills. Preventive measures. Comprehensive sexual education. Providing accurate, age-appropriate sexual education helps adolescents make informed decisions about their sexual and reproductive health. Access to contraception. Ensuring easy access to various contraceptive methods empowers adolescents to prevent unintended pregnancies. Youth-friendly services. Establishing healthcare services tailored to the needs of adolescents encourages them to seek medical advice and access. Contraception. Empowerment programs. Programs that promote self-esteem, communication skills, and decision-making empower adolescents to make responsible choices. Community support. Creating an environment that promotes open conversations about sexual health and provides support for adolescents is essential. Adolescent pregnancy is a multifaceted issue that requires a holistic approach involving education, healthcare, and social support systems. By addressing the root causes, offering preventive measures, and supporting young parents, society can contribute to healthier outcomes for adolescents and their children. Thank you so much for watching. Please like, share and subscribe.